Hello, my name is AJ Scheitler, and I'm honored to serve as the Director of the Data Equity Center at UCLA's Center for Health Policy Research. Today, I am thrilled to share with you some important actions for community engagement to achieve data equity. In this presentation, I will be highlighting the significance of data equity, the integral role of community engagement, and how those elements come together to drive meaningful change in the communities we serve. The goal for data producers should be to have information that is used by the people who can affect positive change. There are many community leaders and organizations that work passionately on health issues, but who are not trained in research or data science, but they can do great things with your data. And in this module, we will lay the groundwork for how you can make that happen. Following this training, you will be able to describe the numerous benefits that community engagement brings, highlighting how it enhances projects and strengthens connections. You will have an introduction on how to incorporate community engagement throughout the entire project lifecycle, identifying critical points where involvement can make a significant impact. You'll start thinking about effective roles for community groups, ensuring that their unique insights and expertise are fully used. And finally, you will understand the reciprocal relationship we build with these groups, emphasizing how mutual investment leads to richer outcomes for everyone involved. The goal of data equity is that all communities in your population of interest are represented in the data. This is especially important when data is used to make decisions that affect each of those communities. Your project goals may evolve and differ slightly by the type of project. These groups are examples of those that are historically underrepresented or not collected at all, but are important identities to include as you construct your study design. Each of these domains or variables provides a piece of the larger puzzle. By considering them collectively, we can build data systems that are truly equitable, systems that reflect the full diversity of human experience and that can drive meaningful change across all levels of society. Our goal is to ensure that every variable is considered and that no community is left out of the conversation. So what is community engagement? It's the process of collaboration with groups affiliated by shared geography, identity, location, or shared interests. Equity begins with giving communities a voice throughout the entire process, from planning to implementation to dissemination. This means actively involving key stakeholders in discussions and decisions. Communities must be visible in the data collected, allowing their unique experiences and needs to shape the narrative. Furthermore, it's vital that communities get to contribute to the understanding and interpretation of the data, ensuring that their insights inform the outcomes. Lastly, community agency is key. Access to relevant information enables communities to take charge of their health and improve their own outcomes. Together, these elements create a robust framework for meaningful community engagement. Engaged community partners are invaluable to your research process, and there are several benefits to this relationship. Community partners help identify relevant data points that may otherwise be overlooked. They ensure that data collection methods are culturally sensitive and they can address historical biases that may be embedded in the research. Community partners can help explain the specific health concerns of different populations, which contributes to study design that is more relevant and accurate. They can also provide highlights into cultural considerations that are critical for ensuring that data collection methods are appropriate and respectful. Additionally, involving community partners in the research process can address the historical biases that have often led to underrepresentation of certain groups in research. This collaborative approach not only improves the quality of data, but also helps to build trust and credibility with the communities that you serve. And it builds important relationships with these communities that have benefits over time. You may run into concerns with some communities that are subject to surveillance or discrimination or fear that data is being used to monitor them or are going to be used against them. When you put the effort into building trust, it enables them to have some say over not just how the data is collected, but also how it's protected and how it's used. Bringing community into your project can be very beneficial for all parties. The greatest benefit of community engagement is the potential for the work to have practical impact. Data should never just sit on a shelf. It must be actively utilized by those who are ready to make a difference. Community groups are uniquely positioned to act on the findings of your research, significantly enhancing its value. By empowering community organizations with the insights derived from your research, you enable them to translate data into action, driving meaningful change and addressing the needs of the community. When data are shared with those who are passionate and equipped to implement it, it transforms from mere numbers into a powerful tool for progress. So let's talk about how to achieve that. This is one representation of a data equity framework, which is a comprehensive approach to ensuring that equity is throughout the entire data lifecycle. There are other modules in this training series that do a deeper dive into each of these areas, but today we will start building the framework, talking about data collection, data processing, analyzing and reporting, and finally distributing the data. Now, this process starts during the designing a data collection project. Including community voice at this stage is foundational for building equity because it determines the quality and inclusiveness of the data that will be used ultimately for decision making. We ensure that data collection efforts capture a broad range of demographic variables like race, ethnicity, gender identity and sexual orientation, disability status, and more, so that the resulting data is truly representative of the population. Now, reaching desired sample sizes in some culturally unique communities, or for example, populations with low English proficiency, may require some out-of-the-box approaches, and community input can inform successful strategies. For example, if a project wants to significantly represent or sufficiently represent Hmong populations, and community leaders share that most of the adults engage in agricultural work and do not usually use smartphones, then a traditional phone-based survey deployed in English and Spanish isn't going to work to really sufficiently capture their voices. Community leaders can inform the strategies that will work, including culturally appropriate questions asked in local dialects using in-language enumerators. Community leaders can also be helpful in recruitment and promoting participation. Once data are collected, the next critical step is processing it in a way that preserves its integrity and ensures accuracy. This includes cleaning, coding, and categorizing the data. During this stage, we must be vigilant about identifying and mitigating any biases that may have been introduced during data collection. Processing also involves understanding the context behind the data. For example, ensuring that categories and classifications reflect the lived experiences of the communities involved and not just the convenience of analysis. In this stage, protecting the confidentiality and privacy of data subjects is paramount. Ethical data processing practices ensure that sensitive information is handled with care, respecting the rights of the individuals. That will involve decisions on things like rolling up or cell suppression. Being transparent and making sure the community understands these decisions is a valuable way to build trust. And that is very important because community engagement is a two-way street. You may receive valuable input on whether your processing decisions make sense, and communities gain an understanding of why decisions are made so that they have confidence in the data that is ultimately shared. This process provides answers to important questions such as, are data aggregated in ways in which communities understand and that they are consistent with how they see themselves? And will weighting produce stable and unbiased estimates of this population? Also, engaging with communities helps in identifying and addressing biases and stereotypes that may exist within datasets. By involving community members in the data processing, it becomes possible to challenge assumptions and ensure that data reflects the lived experiences of all individuals. Here, equity means using analysis methods that are fair, transparent, and sensitive to the nuances of the data. To truly understand disparities, we prioritize disaggregating data by key variables such as race and ethnicity, gender, and other socio-demographic factors. This allows us to identify and address specific inequities that may be hidden in aggregated data. Here again, transparency is very important in building trust with community members. When they are involved in the process, they understand how decisions are made to release or not release data or to roll up to protect privacy. Once analysis is complete, it is important that it resonates with the community. Members can review the findings and provide feedback on both whether there is truth in the information and any context that should be considered. They can ensure analysis are providing the appropriate context and not reinforcing harmful stereotypes. They can also provide recommendations for further analysis or study on the data or in future projects. And if part of this current project is to make recommendations, community members can provide reaction and perspective on the feasibility for the effectiveness of implementing those recommendations. As an example, a recent study looked at barriers to breastfeeding in California. The funder was specifically interested in populations that reported low rates of breastfeeding. So the project included partners that worked with mothers in those specific communities. They were supportive of the goal of the project to identify and break down the barriers that prevent women from achieving their breastfeeding goals that support health for both themselves and their babies. So they helped recruit participants for the study. When we shared findings with them, among them were some things that were common to all mothers in California, such as a lack of family example for breastfeeding. Many women noted that their family members didn't breastfeed, so they didn't have information to share and did not lead by example. However, historical context demonstrated that the reasons for the lack of family history was different among different communities. African Americans versus Native Hawaiians and Pacific Islanders, for example. Similarly, in both of these groups, women felt a lack of support. But again, the reasons behind that feeling was different. The community voices brought in as advisors were able to provide this very important, nuanced perspective. In the end, the community partners reviewed the findings and the recommendations that were made. All information was provided to them to help with their efforts to improve breastfeeding rates in their communities, and it built a rapport with these organizations who hopefully will help us to design future projects to continue this important work. This brings us to the benefits of community in dissemination. That's the final stage in the framework, distribution of the data. It's essential that the data we produce is accessible to all stakeholders, including the communities that contributed to it. However, it's important to recognize that accessing data can be a challenge for some, often due to barriers that limit their ability to utilize this information effectively. Organizations working to make change in a community have a lot of passion for the issues, but they may not have a lot of experience working directly with data. By empowering individuals, we give them a sense of ownership over the data that pertains to them. When communities are actively involved in data collection and analysis, they become better equipped to advocate for their needs and hold decision makers accountable. Furthermore, engaging community members allows for the co-creation of solutions tailored to their specific needs and priorities. This collaborative approach leads to the development of more effective and equitable policies and interventions, ultimately enhancing the overall impact of the data on the community. So, this series has extended training on community engagement and dissemination practices, but it is important to touch on a few things here as it relates to the ongoing cycle of building trust. It's essential to assure that once data is collected, it is shared back with communities in meaningful ways that empower them. Building strong relationships in the community requires transparency throughout the entire process, especially when certain data cannot be made available due to legitimate disclosure risks. For example, the rules of de-identification or anonymization should be clearly communicated to community partners. Additionally, there should be a clear pathway for accessing appropriate data. Ultimately, the data shared must be understandable and presented in actionable formats, enabling communities to effectively leverage the information for their needs. This can bring significant benefits to future data collection efforts. Dissemination is not as easy as handing over a data file. You need to consider their audience and their ability to work with data. On one end of the spectrum are researchers or public health workers with expertise in working with raw data. But at the other end are passionate community workers who may need to learn how to incorporate data into their work but have no formal training. There are many options to consider, from research or public use files to data inquiry systems to customizable publications such as fact sheets to infographics. Community leaders can inform the best methods to disseminate information and make it truly actionable. In some instances, you may offer training or promote training opportunities that can help communities learn how to use this newly available data. Community groups are uniquely positioned to utilize data and findings in their work, as their investment in the project creates a strong incentive for action. But this requires ongoing engagement. We all appreciate research and data initiatives that lead to tangible outcomes. By collaborating with community partners, we can gather valuable feedback on the actions taken based on the data, as well as insights into the results they have observed from implementing any findings. This collaboration not only enhances the relevance of the research, but also fosters a cycle of continuous improvement. Now, the way you seek input and structure the interactions may differ depending on the needs of your project. You can have people that work collaboratively, like work groups or advisory boards, or you can have individual representatives that work independently. You will want to structure the way that you engage with the community that best aligns with your project plan. Building relationships with community groups creates the opportunity for extending and enhancing future work. They provide valued insights into what works and what information is needed to continue advancing health outcomes. Collaborating with community is the path to achieving data equity. Now, one of the key messages I want to leave you with is that community engagement is not a checkbox on a to-do list. It's not something that can be done once and then forgotten. Rather, it's an ongoing, dynamic process that requires sustained effort and commitment. Too often, community engagement is treated as a superficial task, something to be done to fulfill a requirement rather than a genuine effort to involve and empower the community. But true community engagement goes much deeper. It involves building trust, fostering open communication, and creating opportunities for meaningful participation. It's about ensuring that the community has a real voice in the research process from the initial design to the final dissemination of findings. By viewing community engagement as an integral part of your work, you can create research that is more relevant, accurate, and impactful. So, now that we've reached the end, if you want to apply this to your current project, consider the following questions. What are you trying to learn from the study? What is the important information that you need to collect? What populations are important to answering those questions? What groups would help in your current work? And what activities would you design for them to participate in? Thank you very much for your participation today. If in the course of applying these principles to your project, you find yourself in the need of some additional information or help, please feel free to reach out to me at the email address on the screen, and we hope you enjoyed this and the other training modules in this series. Thank you.